Hey everybody, welcome back. This video today is going to be on how to know the signs of a cow that is coming due to calve and how to get yourself through said situation. I'm going to start with a list of things that you should have on hand, and I'm going to be reading this because I have a terrible memory. Ideally, you'd want to have a halter or a lead rope, right? So you can at least walk your cow somewhere, tie your cow somewhere, and this generally applies to like family dairy cows, family milk cows, not really beef cows that are kind of wild and stuff. This applies to cows that you can actually get your hands on fairly easily. The next thing you're going to want is medical gloves, you know, like nitrile, or I don't even know if they sell latex anymore, honestly. Towels to dry the calf off, to lay down to make a clean surface for the calf to deliver into, something like that if you need to, depending on where your cow chooses to calf. They don't always pick a beautiful sunny grassy area. Sometimes they try to do it right in the mud. So if you can kind of try to get your calf up out of the muck as it comes out, that's going to be better for it. Another thing that would work in that scenario would be a bunch of straw, something you can kind of just throw down and soak up fluids and stuff. The next thing is molasses. I think it's a wonderful idea to give cows molasses after they calve. Calcium gluconate in case your cow starts to show symptoms of milk fever. That would be a good thing. An IV set that you'd use to give the calcium gluconate. In addition to that, you can use a vitamin B complex that helps to kind of get the appetite back up and keep the rumen working. When the rumen starts getting sluggish, the metabolism of the cow kind of crashes, and all kinds of things can stem from that. So even though when a cow calves, you're thinking you want to keep her, you know, you hope her uterus is doing good and everything, her you know, udder and things like that, really, the most important thing right then is kind of the rumen. You want to get it full of hay and you want to get it working and functioning again. Everything will follow in place along with that. You can worry about metritis and mastitis, you know, a day or two later. But initially you want to keep that rumen going strong. The next thing that I would encourage you to have on hand would be some form of an oral energy source like propylene glycol, or some tubes that you can get at the feed store that you use kind of like a caulk gun to administer to the cow. The next thing you're going to want would be a calf nipple and bottle, right? So you can feed the calf the colostrum that you're going to milk out of your cow if you're going to try to hand feed or hand raise your calf. If you're just going to leave the calf with the cow, you probably don't need that, but it's always a good idea to know that calf got, you know, a certain amount of milk of colostrum, you know, within a certain number of hours after birth. Ideally you want the calf to have, the average calf, let's say a roughly 80 to 100 pound calf, you generally want them to have around 6 pints of fresh colostrum into their stomach, so that they have the antibodies from the mom and they have the energy to keep, you know, drying off and not get over chilled and things like that. Last things here would be buckets so that you can haul stuff around, and washcloths so you can wash the cow's udder, wash the calf's, you know, eyes off, nose off, you know, whatever you got to do. Wipe the umbilical cord down for the iodine that you're going to put on there. You want to put that on the umbilical stump pretty quickly after the calf's born to keep bacteria and whatnot from traveling up the cord and giving your calf navel ill and things like that. Okay, so those are the things that you should have on hand when your cow is due to calve. The next thing I'm going to talk about is dystocia. And dystocia basically just means that the cow is having trouble passing the calf, getting the calf to come out. The cow's in labor, you know, the bag of water starts to show, and then either nothing happens or one foot comes out the wrong direction. So you need to kind of know what you're looking at and know if it's going to be a problem or if everything's okay. The perfect presentation for a calf is with the 2 front feet, with the hoof, the bottom of the hoof aiming down if the cow is standing, aiming down with the head right between the front legs, like almost like it's just like diving right out of the cow onto the ground. That's the perfect presentation. That's what we're after. Some different types of dystocia would be a breech birth with like the rear feet coming first. And you would know that because the feet are actually turned the other direction as they come out. The bottom of the sole will be aiming up at the sky instead of aiming down at the ground. That tells you it's a breech birth, or, you know, footling first birth. Another thing would be if just the tail is kind of, you reach in there and all you feel is like a little squishy tail, that means it's hips first, right? And the cow can't pass that. The calf will have to buckle up and try to, it won't work. You got to turn them around, or, you know, get them flipped around somehow. Another thing would be if it's just one foot, if you see one little foot coming out but another foot doesn't follow, you're going to need to reach in there and feel along the leg you do have, go to the other side, feel along that shoulder, find where the foot is crooked up, and see if you can straighten it out and pull it forward out of the uterus, or out of the vaginal canal, so that you can get the cow or the calf, aiming both feet forward. And the last one, and this is the one I hate the most, is, and I seems to have the most problem with, and that is when the head is curled back or the neck is curled back, and you basically have a presentation of 2 front feet and the neck's pulled back like this, which they can't pass that either. You need to get the head, you need to reach into the cow, feel for the neck, feel along the neck, feel along the cheek, find that jaw, and pull the head forward and see if you can get it lined up between those 2 front legs. Sometimes you might need the assistance of a obstetrical snare, which is kind of just like a loop of cable with like a slidey thing on it, so that you can kind of rope around the calves behind the ears here, and you get that snare here and you tighten it, and that will help bring the face forward towards the outside. But you definitely need to get your hands in there and twist stuff around. So dystocia isn't super common, but it does happen, and it's something you need to be prepared for. You either need to like call the vet out quickly so the vet can do it, or if it's one of those situations like here where the vet's at least an hour away if I'm lucky, you need to be prepared to dive in there and try to do it yourself. The most important thing would be to wash your arms and your hands, lube them up so they're slippery, so you're not causing damage to the cow's inside bits, and then just be patient. Worst case scenario, you hope, would be that the calf doesn't make it, but your cow does. Your cow's really important. So what you want to do is, get your hand in there, feel around, be slow, and just try to visualize what you're touching. If you think you feel something, it's like, what is that? And you pull on it and oh, that's an ear. Okay. So now you're near the head, right? So just keep working with the feelings that you're feeling in there. And most things, you can push the calf back, push it back inside a little bit, reach around, pull a leg forward, and then start it back out again. Or, if it's rear end first, you might be able to spin it around to get the front end first, or you might have to go ahead and just pull the back end, make sure both back legs are coming out, and reach in there and just crank the calf out backwards. It's doable as well. You need everything to be like aiming so that the calf is basically diving out or flying out onto his back legs, I guess. So those are my big suggestions. Let's go ahead and get on with the video, because this has been very wordy. All right, good luck with your cows. Bye. Well, we are now 1 week over her due date. She was AI'd, so I know her exact due date. To me, this isn't a whole lot of difference yet. So this is still kind of stiff through here. This will dip down significantly when she's ready to calf. I'm not seeing it too much yet on this side. A little bit more over here, but I think it's just different odd conformation on her. A little more of a dip right here, but still see this. What we're primarily looking at is this right here. This one ligament that cuts across here. When this goes and softens, this whole thing will just have this weird C shape that kind of cuts through here. You'll also see a lot more of the individual bone dips in this tail here, right along this part here. It'll just look more hollow. The cow will look kind of starved. Like, wait till you'll think, oh yeah, I was doing a good job feeding her, and now she looks terrible. Because her belly will go from being sticking out this way to dropping down. They call it slab-sided. And suddenly her belly will look way down here. It'll be all filled in under here. But from the front and the rear, she'll look really thin. And it'll look kind of strange. She's starting to drop a little, but not really. Also, because of the softening of the ligaments, you'll start to see, at least in a summer cow, it's a little furry here. You're okay. You'll start to see the ribs through here. You might see, depending on the conformation of your cow, some of the spine up through here. Just in general, the cow just suddenly kind of looks, I don't know, melted, sort of. All the bones. You can see the frame through the fur, through the hide, and you start questioning whether you have been feeding your cow properly. Those are all good signs that she's about to calve, because her hormones are softening everything up, making it so her pelvic girdle here will open up and be able to pass the calf easier. The fact that this cow is now 7 days overdue leads me to believe this is more than likely a bull calf. So far, I've never been proven wrong, though I don't have a huge pool to pull from, because we've only had maybe, I don't know, 15 or 20 calves born here to dairy cows that I knew due dates and whatnot, so I knew if they went over, went under. Usually cows that calve before or on their due date, 75% of those will be heifers, and once they go over their due date, it seems like that flips and you end up with 75% chance that it'll be a bull. So we'll see, but I'm starting to think now that she's a week late that this is going to be a bull. We'll keep you posted. I don't think because of the wind you can hear it, but she's doing little mama moos, we call them, where she goes, like that. That is a very strong indicator that she's going to calve in the next, I don't know, maybe 2 hours or so. See how the tail's being held out? So she's kind of squatty. You can see she's dripping colostrum from the rear teat there. She keeps glancing over her shoulder and looking at her back. These are all strong indications that she's near decalving. There's another moo. Seeing a foot coming out. It looks like it's aiming the correct direction. You want the feet to be pointing out and towards the ground as if they're jumping out of the cow and going to land. Obviously, if she was standing, that's what I'm talking about, not in the laying position. I'd like to see the second hoof there. That would make me feel a lot better that this is a normal presentation. With one foot not there, that means it might be curled back, which won't, that kind of binds up the shoulders and they won't pass through the pelvic arch very easily, so you kind of have to go in there and fish that other foot forward. Another thing is, once the feet present, I'd like to see the tongue next, and the tongue tells me that the head's in the proper position, as if the calf's literally got its front legs straight out with its head between them, diving out of the cow. There's the other little foot. So far, so good. See this right here? That's the tongue. That tells me this is a normal presentation. Baby's diving out, head's right there on top of the knees. Usually the tongue comes out before anything else. It's always poking out, so that's a good sign. Now if she can just keep progressing, we'll be done here pretty shortly. girl. One more big push. Ta-da. You all right, girly? Oh, so tired. There he is. Let's take a look. Yep, it's a bull calf. There's a little goodie bag. Good boy, welcome to the world. First thing we do is clear the nose, make sure that it's not full of snot and goo, make sure the calf's breathing. I spun this little guy downhill so the gravity would help kind of clear his lungs a little bit. Mom's already up, doing her job kind of cleaning him up. At some point here, I will put him in the wheelbarrow that I brought over and haul him back over to the barn. Inside here, where I was sitting, I have the towels, there's my gloves, and the iodine spray that I'll use on his umbilical cord. And that's pretty much it. We'll get him inside the barn, put a jacket on him probably. It's not super cold, but it is raining. And get him dried up. We'll milk some colostrum out of her and see if he'll take a bottle. If he won't, we'll just tube feed him some. And then they'll both be pretty much set for the next 12 hours. We'll make sure that she's doing good, keep an eye on her. You know, watch as she drops her placenta at some point here. If she doesn't, we will give her some calcium gluconate sub-Q over her shoulder blades, or on her, you know, along her ribs there, 500 cc's of that, and that usually does the trick. Next step to getting Mama off on the right foot is to give her some warm molasses water. So here's a 5-gallon bucket full of hot water that I just got from the tap at the house. Here's my molasses. I will add a fair amount to that, probably around a gallon. And then I'll put my hot water in there and I'll add probably the same amount of cold water, maybe 4 gallons, 3.5 gallons, something like that, just to make it warm. And then I'll let her out of her stanchion there and let her poke her head through here and hopefully get a big nice drink. And that will go far to giving her some calcium and also some sugars just to deal with the stress that she had today. Come on, girl. Good girl. Okay, the next thing I'll do here is check and make sure that this little guy has a suckle reflex of some sort, just because, there it is, yep. Just touch the front of their nose there, and they should lean forward and their little mouth should kind of open and stuff. So the reason that is because I'm going to hand milk the cow some colostrum into a milk bottle, and I want to make sure that he drinks it quickly, that he's interested, because I don't want it to sit out and get cold, and I don't want to take it back down to the house and try to heat it and everything. I'd like to just get it out of the cow and get it right into him as quickly as possible. And then once he's taken care of, then I can open her head gates and let her, you know, do whatever she needs to do to feel better. Hopefully she'll go eat some hay. Ideally, when a cow calves, you want to try to get them full of hay quick, because that can help like expand their rumen out and keep them from getting displaced abomasum. I got a full bottle of beautiful yellow colostrum, and we're going here and see if we can get this little guy to eat. Hey, baby. The way I like to do this is straddle their heads, their shoulders. Ideally, they're up, standing, but we're just going to go with this. And then use one hand here to cup underneath their head so that you can kind of hold their little mouth shut as they figure out what's going on, and then use the hand that I'm holding the camera with to manage the bottle.